Hey, good afternoon, everybody. It's Dr. McDade from McDade Family Chiropractic here in Rochester, New York, and just wanted to take a quick minute to do a research review on a great case study that just was published in the Journal of Pediatric Maternal and Family Health. It was just published just a few days ago, and it's in regards to colic. And if anybody out there is ever is a parent that's ever had a baby that has been colicky or having trouble sleeping or eating, you know how your heart goes out to that little one, and you would do anything to help solve that problem so that your child could begin to be more comfortable and not be crying like that. You know, colic, there's no definitive diagnosis for it, but it is there's some characteristic signs for it. It's where the baby's been crying for periods of at least 3 hours, unconsolable crying for at least 3 weeks, and that is one of the diagnostic criteria or subjective criteria that a parent would share with their pediatrician for that diagnostic or diagnosis, excuse me, of colic. And in my time of being in practice for the last 14 years, I know I've had a handful of colicky babies that have come in and all responded great to chiropractic care. So it's great to see case studies like this being published. But in this case study, a little baby boy that had infantile colic, torticollis, which is a twisting of the neck where the muscles on the one neck are tighter than the other, so the baby has a hard time straightening its neck out, and plagiocephaly, which is like a flat spot in the head. And the baby was having a lot of trouble breastfeeding because he couldn't turn his head one way or the other without pain and discomfort, and because of what was going on with it. Anyways, after the first chiropractic adjustment, which consisted of a very gentle tapping motion or actually sustained contact just with a pinky finger to the upper portion of the neck, this baby, his mother reported a noticeable difference in the comfort level, and the amount of crying decreased drastically after that first adjustment. And within 4 visits, the mom reported that the baby was completely colic-free. The torticollis had straightened out, so the baby wasn't stuck in that position any longer. It was able to breastfeed on both sides, and the plagiocephaly, or that flattening of the head, began to show signs that it was reversing as well. And that's pretty much what we see in our practice, and what a lot of other case studies and case series have shown, that within a handful of office visits to the chiropractor, the majority of babies that are colicky really begin to feel much more comfortable, and the parents notice great changes in those babies, as well as torticollis tends to clear up relatively easy in a lot of kids. But again, it depends on whether it is based on birth trauma or if it's based on in uterine constraint, like how the baby was developing when it was inside the mom's uterus before it was born. They can take a little bit longer if the baby kind of grew with its head in a crooked direction for a long period of time. They can take a little bit longer than the traumatic ones from the birthing process. So I hope you found this this research review interesting. If you would like a copy of this research review, you can go to our website that's listed here and just follow the links to the research portion of our website, where we have research and case studies published or for you guys to basically download and look at. All right, have a great day. Again, it's Dr. McDade from McDade Family Chiropractic. If you have any questions, feel free to give us a call or email us. Have a great day. Take care. Bye.